Hello everyone, my name is James Fox and I'm the Program Director here at the UT Tyler School of Medicine Residency Program in Internal Medicine at UT Health East Texas. It's my privilege to welcome you to this interview day experience and we look forward to meeting all of you. What I hope to accomplish in a very short period of time is to inform you about the aspects of our program that make it a truly unique and special training opportunity. First of all, I would like to tell you about East Texas as a region. Tyler is centered in between Dallas and Shreveport, with a region that spans all the way up to the border of Oklahoma and about midway down to Houston. That gives us a population of about 2 million patients. Tyler serving as the hub of this region and a tertiary referral center from across the area. When you take into account the size of our state, East Texas alone is about the size of West Virginia. And if you look at the health outcomes for our region, you'll notice that they do not rank well if we were to be compared to other states within the U.S., just based off of our East Texas pathology alone. This heat map helps to demonstrate how health outcomes across the South, particularly as it relates to life expectancy, do not stack up well against other metropolitan areas of the state or other areas of the country. Smith County in East Texas is a member of these areas within the southern portion of the U.S. where life expectancy is clearly lower than others. And this is why the mission of UT Health East Texas is not only to train healthcare providers to improve the health outcomes of East Texans, but all Texans and those around the country. What this also means is that our residents here are exposed to an incredible array of various pathology and get to see everything that they need to be able to experience to become very accomplished and prepared internal medicine physicians for pursuing careers in either general internal medicine or internal medicine subspecialties in the future. Our mission is to train the future generation of physicians to be leaders, to provide excellence in patient care, as well as research and public health, being able to begin their careers as successful leaders and innovators in whatever the career field is of their choosing. We genuinely believe that the opportunities provided here during training can catapult a trainee into any area of medicine in any career path that they so choose. There are several reasons why our residents get such a great training experience here at UT Health East Texas. One is the hands-on approach to learning with an appropriate degree of autonomy. Residents are allowed to be the first up to evaluate and treat patients, including procedures. They also learn within a resident-focused training environment and a curriculum focused on them. Additionally, there's mentorship that gives them opportunities for a very close working relationship with our faculty, and also provided opportunities for research, public health, and quality improvement that really allows our residents to hone their specific interests during training. Residents are prepared to graduate and practice within their desired career field, whether this might be clinical medicine, academic medicine, or research. Our leadership includes our Chair of Medicine, Dr. Jarrett Berry, an established researcher and cardiologist within the field of preventative cardiology. Our designated institutional official, Dr. Emmanuel Eloise, brings a wealth of experience in graduate medical education. As a former program director himself, he's a great mentor, and our team, including our associate program directors, Dr. Catherine Root and Dr. Bhavani Saradevera, with myself and our chief residents, Dr. Devin Haney and Layla Farahani, all work very closely with our residents and are supported greatly by our program coordinators, Ms. Angela Beatty and Ms. Michelle Yarbrough. We have several training sites that are all within a close proximity, with our primary training site being UT Health Tyler. UT Health Tyler is a level 1 trauma center where all of the inpatient rotations occur for our internal medicine residents. This includes the emergency room as well as the wards, ICU, and neurology rotations, in addition to cardiology and night float, as well as elective. The Internal Medicine Resident Continuity Clinic is a partnership with the Tyler Family Circle of Care, which is a federally qualified healthcare center, and we have a collaborative primary care clinic that serves the underserved area of East Texas and North Tyler. It's located just 10 minutes away from the hospital on West Gentry. And we have an additional ambulatory site, which is the UT Health North Campus, situated 15 minutes north of our UT Health Tyler Hospital, is the site of our ambulatory medical subspecialty rotations. These include pulmonary, cardiology, endocrine, GI, hemonc, infectious disease, allergy and immunology, as well as rheumatology, in addition to a substance use disorder rotation. Additionally, we have a Tyler VA clinic where we perform an ambulatory rotation as a part of the ambulatory blocks within the South Tyler VA clinic. It provides an excellent opportunity to help provide care for our veterans and experience a different healthcare setting and system. The UT Tyler School of Medicine has a UT Health Tyler Midtown campus location that is currently under construction and will be completed next year in 2025. The first class of 40 medical students started in June of 2023, and we're excited about them entering our clinical clerkships soon in January 2025, when they will be rotating on our internal medicine services during their clerkship time. A couple of other areas on the North Campus to note is the School of Biological Sciences, where a Master of Science in Biotechnology is available, as well as a School of Community and Rural Health, also located on the North Campus, where an MPH as well as Masters of Health Administration are available. These just demonstrate some of the other well-rounded resources that are available within the Health Science Center. There are several fellowship programs that have started last year and this year. Cardiology as well as GI and palliative care started last year and currently are within their second year. And we're excited about having pulmonary and critical care as well as hematology, oncology, and nephrology that have started this year. We plan for additional medical specialties that will be developing in the upcoming years. There are also multiple other residency programs involved with the UT Health Science Center, including a family medicine residency program that has been in place for over 35 years, as well as additional programs in psychiatry and general surgery, anesthesia, which began this year, also having occupational and preventative medicine and a transitional year medicine program with future specialties, including things such as emergency medicine planned in the future, along with pediatrics. Let's talk further about the curriculum here, having a 4+2 X+Y team system. We have 3 resident teams, a red team, green team, and blue team. And each of these teams is on a 4-week inpatient block that is then accompanied by 2 weeks of ambulatory time. That means on ambulatory time, they participate in continuity clinic as well as ambulatory didactics, in addition to having dedicated administrative time. This allows them opportunities to work on QI projects as well as research or other study time. Additionally, during the ambulatory time, there is a medical subspecialty that they participate in addition to some rotations where non-medicine specialties such as ophthalmology and dermatology are available, or there's a primary care experience that is available too, as we emphasize the importance of primary care and training future primary care providers also. Additionally, we believe this all optimizes opportunities for the resident education and well-being. Residents are able to focus on their hospital and their ambulatory time without having conflict between the two or interruptions. This provides dedicated time for lectures and didactics and minimized distractions to learning. Additionally, it provides golden weekends that can be used for planning for personal time, having 2 golden weekends being a Saturday and Sunday together off during each of the 2 ambulatory weeks during the ambulatory block. Going further into some of the PGY1 core rotations, we consider the PGY1 year a core year where residents participate in 15 weeks of internal medicine wards and 8 weeks of intensive care unit. There's an additional 4 weeks of cardiology and 4 weeks of emergency medicine. There are 3 weeks of night float and then 16 weeks of ambulatory medicine that are included within the PGY1 year. In progressing to the PGY2 year, these core rotations continue, although there's now opportunities for electives. So wards takes up 8 weeks and ICU 8 weeks with cardiology 4 weeks and neurology added as a 4-week inpatient rotation. There's still 3 weeks of night float and 18 weeks of ambulatory, along with 8 weeks of elective time. In progressing to the third year, there continue to be these core rotations and additional elective time. This mirrors to great extent what the PGY2 year looks like, except that neurology is not included in the third year, adding that additional time to include a total of 12 weeks of elective, along with the 18 weeks of ambulatory time. Our inpatient team structure varies based off the type of service. For example, our internal medicine ward service has a traditional team of 1 upper-level resident working with 2 to 3 interns. We also have another team that we call Ward H, or our hospitalist team. This is an upper-level resident rotation, pairing 2 upper-level residents together for an upbeat and faster-paced environment that simulates what it's like to pursue a career in hospital medicine, working directly with our attending. Upper-level residents get to spend time both as the senior resident on the traditional team, in addition to participating with the hospitalist team. Furthermore, we have the admitting team. The admitting team consists of 1 resident and 2 interns and participates on an admitting rotation where there's a great opportunity to help admit patients from the emergency room. Our night float team participates in this as well, consisting of 1 to 2 residents and 1 to 2 interns, where in addition to performing admissions at night, they also provide cross coverage for our internal medicine ward services. The ICU and cardiology services are 1 resident and 1 intern pairs. There's frequently a float resident also present on these services. And our neurology rotation, as I previously mentioned, is for PGY2 residents. Night call occurs every 4th night during the ICU rotation and the cardiology rotations. There's an additional 1 night per month call that occurs on the ward rotation for interns only. This is to allow our interns the opportunity to have coverage at night while they transition from the night float to the day services after the conclusion of their night float week. There's a total of 3 weeks of night float that's spread across the academic year. These are separated into a 2-week block and a 1-week block. Again, the night float will provide coverage for patients on the internal medicine teaching services while performing admissions to the services as well. Talking a little bit more about the ambulatory curriculum that I went into previously, we spend 4 total weeks over the entire course of the 3 years of training during ambulatory time, focusing on each of the internal medicine specialties. This includes a 4-week rotation in geriatrics, as well as a 2-week substance use disorder rotation and a 2-week VA primary care rotation. What this allows is for our residents to experience the entire spectrum of internal medicine and really focus on those areas as they read and study and prepare for their boards. There are these opportunities for electives in the non-medical specialties that I referenced. And then our continuity clinic not only includes weekly dedicated ambulatory didactics, but also includes administrative time to help complete projects and work on study time as well. This is a representation of our conference schedule. We have afternoon report that occurs on Mondays, Tuesdays, and Thursdays during the noon hour. Lunch is provided, and we believe that afternoon report during the noon hour helps our residents by freeing them up in the morning time so that they do not have to rush around the hospital and try to make it to morning report in between all of their pre-rounding and attending rounds. This has worked extremely well for our program, and we're very proud of the opportunities that it's allowed for our residents to present cases and learn with our esteemed faculty during the afternoon report time. On Wednesdays, we have an academic half day with a noontime conference. This is typically resident-led and includes topics such as journal club and case conference, as well as patient safety conference. And then we have 2 core curriculum lectures that follow. We have a curriculum that spans the 3 years of training where residents get to experience and learn about all of the core topics throughout internal medicine. Friday, we have a grand rounds during the noon hour, and then Our residents on ambulatory have administrative time in the afternoons. Other conferences that we conduct are things like communication skills, board review, QI workshops, as well as resident town hall and resident wellness events. Additionally, residents receive an opportunity to participate in procedural simulation. The medical school has an advanced procedural simulation center, and residents get to practice ACLS as well as multiple procedures. We have mannequins as well as ultrasound, including procedures such as thoracentesis and paracentesis, lumbar puncture, intubation, central line insertion, and ACLS. We're excited to be integrating POCUS with dedicated didactics and POCUS rounds that occur during the ER rotation as well as during the ICU rotation. Educational resources that are available include a laptop that are provided for work use. Residents use the New Innovations Residency platform, and all residents receive access to the Medical Knowledge Self-Assessment Program through the American College of Physicians for their board preparation. Up-to-date and Dynametics are both available for direct patient care reference when in the clinic as well as in the hospital. Furthermore, the North Campus Library has an extensive database of medical journals that are available electronically, including interlibrary loan for articles that are needed that are not directly available. There's additional electronic resources available through the North Campus Library as well, including electronic versions of textbooks. Our residents all have an opportunity to participate in scholarly activity during their training. Residents will work on a scholarly activity project that might include either quality improvement and or research that they present in the form of a poster, their findings at the annual Institutional Scholarly Activity Forum occurring in May each year. Our residents have been very successful in presenting at this forum, being recognized for their work with awards, as well as presenting at numerous outside regional and national forums as well. There are many opportunities for creation of abstracts and posters to present both locally, regionally, and nationally. And here's just a few examples of our residents who have been successful in doing so. Faculty mentoring is very important for our residents. You will be hard pressed to find a program where you would have this type of very close and collegial working relationship with faculty. Our faculty are present throughout the day. They're frequently checking in on our residents and generally care about their well-being. We have an assigned faculty mentor where residents are able to meet with them at least quarterly and more frequently if needed to review their training performance as well as get guidance for training experience, future career planning, and assisting with their professional development. We also want to prepare our residents to be leaders. Leaders on various committees and opportunities are available. There's a Resident Patient Safety and Quality Improvement Council, a Research Council, as well as institutional and program wellness councils, hospital quality improvement, diversity and inclusion, and other medicine subcommittees within the UT Tyler School of Medicine are all opportunities for our residents to be involved with. Wellness is something that is taken very seriously from the institutional and internal medicine residency program standpoint, for trainees, but also for our nurses, physicians, and other staff. We have a wellness council within the institution as well as within the program with resident representatives. These representatives provide crucial feedback, help plan events and outings, and are very important in ensuring that we continue to provide wellness to our residents and the rest of our staff and faculty here at UT Healthies Texas. There's a discounted membership at the UT Healthies Texas Olympic Center, which is a state-of-the-art fitness center with cardiovascular and strength training equipment, as well as fitness studios and a saltwater pool. This facility is connected to the hospital via skywalk and easily accessible. The residents have done a great job here in creating a culture where, yes, we do things within the program, but they have gotten together outside of the program in doing activities such as participating in indoor soccer, different various holiday activities, outings for meals, and then also various wellness activities that we perform during our didactic time that we celebrate during the holidays. Additionally, we like to introduce our new interns through some team building, such as escape rooms, whenever we begin the residency orientation. The City of Tyler has a number of different area attractions. Beautiful outdoor attractions exist, whether it be camping or lake activities. There's golf, a number of very nice parks within the city, in addition to Tyler State Park, located just 15 minutes away with a lake, great hiking trails, and a lot of different outdoor activities. I like to say that this picture at the bottom of the screen of the road coursing through the woods is the traffic situation here in Tyler. It's so nice not to have to deal with traffic issues going to and from work each day, and to know that you can get to and from your rotations easily without problems. Other area attractions include things like our Tyler Rose Garden, which is a 14-acre rose garden, the largest in the country. We have a number of great shopping venues. We have a symphony orchestra, a museum of art, a number of different beautiful outdoor gatherings, including our azalea trail and an outstanding zoo as well. You can find everything that you would locate in a larger city here in Tyler to a smaller scale, just short of some of the major sporting events that you only find in the bigger cities. But those are easily things that you can access just a couple of hours away to Dallas, 3 hours away to Houston, and very easily accessible to other areas, including Austin and other parts of the state. As far as vacation and benefits, residents receive a total of 3 weeks of vacation during the academic year, which are taken on approved rotations. There are additional personal days that residents can take when scheduled in advance also. A $500 educational allowance is provided to the residents for use each year, and benefits include medical, dental, and vision. Life insurance and disability insurance are also available, as well as a retirement savings plan. The personal liability insurance is provided for all of our trainees. Let's discuss some logistics regarding the interview day. Ahead of your interview, you will receive 2 meeting invitations for Microsoft Teams. One of these will include a question and answer time at 12 p.m. Central Time with our program leadership. This is an opportunity for you to bring questions that we have not covered during this program interview, and we look forward to answering those. Additionally, we think that it's extremely important for you to have some time with our residents to get a sense of what the culture is like and ask candid questions. And so from 12:30 to 1 p.m. on this same meeting invitation, you will have the opportunity to do this. The second meeting invitation that you will receive will actually be specific to you as it relates to your interviews. Each of you will have 2 interviews throughout the afternoon. One of those interviews will be a 30-minute interview with a faculty member, and the second interview will be a briefer 15-minute interview with myself. And so your email invitation is going to specify which of these times, so please pay close attention to these. Some additional virtual interview details. Using Microsoft Teams, if you have a PC with Microsoft Windows, you can either join the meeting via a web browser using the link from your email, even if you do not have a Microsoft Teams account. Or should you have an account, you can use your own account to access the meeting. Those of you using Mac, smartphone, or some other tablet platform, you're going to need to have the Microsoft Teams application downloaded ahead of time. It's a free application within your App Store. You'll need to give access to your microphone and camera, and then you can join either as a guest or use a personal Microsoft Teams account should you have one. Should we develop any technical issues over the course of the interview day, particularly when it's time for your specific interviews with the faculty or myself, we'll call you by phone to conduct the interview as a backup should it come to that. Please make sure you have your phone available to use as a backup during this situation. Applications are only accepted through ARIS, and all applicants are matched through NRMP only. We're conducting only virtual interviews this year, although each of you will be invited to participate in an open house where you can come to our facility, take a tour, meet our residents, as well as our faculty. We will have 2 open house opportunities at the middle and at the end of the interview season, and we'll be providing you information regarding those in the very near future. You'll see our program website here, and I invite you to go to the website and review the resources there. I also invite you to review our ACP Showcase video that's available online through the American College of Physicians. Finally, here's our email and phone number contact should you need any assistance or need to contact us. We appreciate your interest in our program, and we're very excited about the opportunity to meet you and answer your questions on the interview day. Again, I want to thank you for taking the time to review this program overview in advance. We are very excited about what we have to offer here at our internal medicine residency program. To summarize, I would say that our program provides a very hands-on approach to learning with a very resident-focused curriculum, the 4+2 that focuses on resident wellness and provides extremely diverse pathology and opportunities for resident learning. Our residents are immersed in a training environment that prepares them to really launch out into a career path, be it academics or private practice, whether it might be within a medical subspecialty, primary care, or hospital medicine. The in-depth involvement of our faculty with our residents here is uncomparable to any place that you will visit. And we believe that if you give that opportunity for us to show you that here, you'll really find that it's a very special, friendly, and collegial place to train. With all that said, I want to thank you so much for your time.